Hello and welcome to the My Dietitian Journey podcast. I'm Adam. That's Felicia. She's the dietitian. I'm just some guy. We're on a Q&A episode.
Yes.
Or FAQ.
Yeah.
Episode 2 of the FAQ. This time focused on telehealth and insurance-related queries, questions, quizzically posited to our residential expert, Felicia Peraza of Peraza Nutrition and My Dietitian Journey, fame and fortune. All right. Is that good?
Yeah, it's
prestigious.
Good. Yeah. For educational purposes only.
Yeah, this is, again, we're, legal, blah, blah, blah. See the description so you can't sue us. Well, we're going to talk about telehealth, which is a really big deal right now still and continues to be developing even more. Things are changing around it. So some of this may be not the most up-to-date information in a few years.
Yeah,
maybe.
a few years, maybe.
But, for right now and for the foreseeable future, this is the case. And this is all stuff she's experienced with her practice, not necessarily things technically speaking.
Yeah.
But let's get rolling here. So first question for telehealth. What are some barriers you find with doing telehealth appointments?
So first one is definitely the barrier of technology. So it's not to say that clients, whether they're older or younger, are going to automatically have technology issues. But that's a huge thing that I saw in terms of how to actually access the telehealth appointment. Do they need to download an app? How to check their mic and things like that. So this can be time consuming if you're the one walking somebody through how to actually set up the appointment. And this is also something to consider if you're using an online platform as to, do they have help guides available? So that way you can direct your client to something that's already pre-outlined as to here's how you log onto your appointment and here's what you need to do. And so it can help with that.
Would you use an EMR and the client, patient, is the word patient appropriate or not?
Mostly client.
I mean,
patient still works.
You're a provider and you're providing medical nutrition therapy. The word patient seems apt, but whatever.
Yeah.
Clients, your clients, they are accessing you and the appointment through a portal, I guess?
Yeah. So with mine, I use Simple Practice. And the way that this platform works is they get a unique link for their appointment. And so if they're on a computer, they would click the link. It opens up in a browser.
It's sent via email, I assume?
Email and or text, depending on what's on consent for them, on file for consent.
Are they able to actually conduct the appointment with you from their cell phone?
Yes. So if they use their phone, which something I learned is that it will automatically direct them to downloading an app from the App Store. So making sure your client has space on their mobile device.
Has that been an issue?
Yes. I had one client had an issue. Another one forgot their password for the
for downloading apps.
Yes.
Wow.
And for some people don't have it saved or if they change their password, but those are a little bit more unique issues. But
that's how Zoom works too. Mm-hmm. If you get a Zoom link, it tells you to download the app. It's the same sort of thing, although you don't use Zoom for this.
No, although they do have a HIPAA compliant version that's a paid option that came out.
Well, that's an option for some, I guess.
Yeah, it's just another thing. But the one I use, click the link, and if it's the app that they download that's free, it brings them right to the screen to enter their name, and then they are right into the appointment. So
that's a barrier. Sometimes technology can create a barrier in terms of accessibility. What else are you thinking? Yeah,
and I will say for those kinds of things that it's the first couple times, and then they are in a routine.
Well,
so it gets a lot easier.
Right?
Video lag can certainly be an issue. So I've had people who have really terrible Wi-Fi or just connectivity issues. And so the lag and trying to stay in the appointment with them. And I've actually had a few instances where we keep the video up and then we do a phone call. And so that way I could see them, but there's no issue with.
There's an audio lag, or
yes.
The video audio are out of sync?
They're out of sync. And so it's hard when you're doing telehealth because you're trying to make sure you're not interrupting a client. And so you're looking at them and trying to look at body language. And if they freeze for a second, then I'm I don't know if they actually stop talking or if they are continuing to talk and it's just a little bit of a delay. And so that's
something that I think as 5G home networks become more and more common, I think that will all but be eliminated eventually, probably in a few years.
Yeah. And then another big issue, which I've only really encountered more recently, is location related. So something to consider when you are setting up your telehealth and working with clients through telehealth platforms is what's an appropriate location for them to be sitting for the appointment. Will you let them go for, let them is a weird way to say it, but, can they be walking while they talk to you? Can they be driving while they're talking to you? Do they have to be stationary? And so those are things to consider, because you don't think about them until all of a sudden they happen and someone's in the car and you're like, oh.
Yeah, I'm sure that's a thing when people try to pull that, where they're trying to conduct their appointment with you while they're driving. You're hearing like turn signals and horns honking and stuff.
Yeah.
Is your attention really on the appointment? You're dealing with someone who's divided?
Yes. And so I've had people in their car where they're like, late picking somebody up and they like pull over, or they're dropping off a kid. And so they, they're in their car, but they're like parked, in a lot somewhere or something like that. Or they were at work and they couldn't have the appointment being in the workplace, so they went out to their car for privacy. So there's certainly, ways to get around that. But that's another kind of barrier that I've faced in terms of like then setting up a policy and explaining that to clients before, because sometimes they'll say, well, I didn't want to cancel the appointment. And so, what's your policy on that then?
Yeah, I guess at a certain point you have to be flexible, because if this sort of thing gets canceled, it can have a tendency to roll through weeks or maybe even a month or two before they actually reschedule and sit down for it. So, all right, well, with those barriers in mind, do you have any tips for conducting successful assessments via telehealth?
So one, making sure that your client is completely aware of what they're going to need to do for the appointment. So when I schedule telehealth, I let them know, if you're on a computer, that you're going to need to open a browser. It'll open in a browser. You just have to make sure that your mic is connected. The other big thing is like for the app. So I instruct them to download the app ahead of time. So being as very clear about what they're going to need to do, and suggesting that they read through, if you send them an information sheet or a link, read through that ahead of time, and then block off a little bit of time the day of the appointment. So maybe logging in like a few minutes earlier and making sure you have a contact for them on file. So if they're running into any issues and they're a minute or so late, you can touch base with them to know. So that I found can help. Being patient is also a really big thing too, because a lot of my clients are frustrated with using the technology. And so if they're not already using technology in their workplace, it can be pretty frustrating to do the appointment. And so they'll, maybe not want to have a session. And so being very patient and understanding and empathetic for them, because it's not as easy for them as you, maybe.
So being patient and being proactive, basically.
Yeah. And even, again, being very clear about what the expectation is. So letting the client know, for the appointment, not driving, and however you want to phrase that. But so again, they're not caught off guard when they come to the session, thinking that they're ready to have an appointment with you. And then in reality, you're telling them, no, my policy is this and that. That could be pretty frustrating too.
Expect the unexpected.
Yes. And then having a backup plan in place. So for sure, like I always make sure I have a good contact phone number on file, and I let them know, hey, if we're having any like lag issues, we'll keep the video up. So it's, still there. And then we have the phone as the option to be able to kind of bring that in. So we're not disrupting the appointment so much. So.
Okay. Good stuff. So telehealth, being that you can be in any place and they can be in any place, of course, you have to wonder about crossing state lines in the United States. There may be other things internationally, but for those of us in the U.S., are you able to see people in other states or in any state? And is there some kind of licensure required outside of your jurisdiction, I guess? Yeah.
So this question is one that I've seen asked many of times, and in every group that I'm in as a dietitian, like the Facebook groups and all that kind of stuff, like this comes up at least once every couple of days. So you generally will need to be licensed in the state that your client is located. Now, not every state has licensure. Some just have what's called title protection. So, you can't be a dietitian. You can't use the term dietitian or licensed dietitian without having, the credentials to do so. So some have that title protection. Some have what's called practice exclusivity, which means that a license is required to practice in that state for MNT, so medical nutrition therapy. So in general, though, you will need to be licensed in the state where your client is located. So if they drive across state lines during the appointment, you need to be licensed in the state that they are currently in. So it doesn't necessarily go by their home address, but where they are physically located.
What a bunch of nonsense.
Yes.
Well, I mean, there's reasons for these laws, but you have a license in Pennsylvania. That's where we're located.
Mm-hmm. There
are other states that don't require a license, but are there any states that sort of reciprocate your licensure in Pennsylvania?
There is. And so I don't remember off the top of my head, but we're going to link in the description or in the show
or the
notes.
Show notes. Yeah.
Links to the Academy has this map. It's very colorful. It's red, orange, and green colors. And so it shows which state has title protection, which state you need a license for. So it would be like practice exclusivity. So they'd be red states that you need to have a license. But some states do have this reciprocity.
Yeah, it's a reciprocity. Yeah. It's the
And
same thing with other licensure too.
And it's nice, for states, because then you have to just pay the fee, but there's not as much paperwork necessarily involved. And then there's also, especially with COVID right now, there was a little bit more, not necessarily lax.
It's a little more lenient. Right?
Yeah, a little bit more lenient, or they were granting temporary or provisional licenses for individuals who were practicing in different states. So those are things to also consider now, is that, with COVID, that you might be able to maybe get in with a state a little bit easier or with some flexibility.
So can I ask about you personally? You're licensed in PA. Which states reciprocate that licensure? Off the top of your head, do you remember?
No, and then part of it, so I know.
Sorry, I put you on the spot.
I know, and I shouldn't. And part of why it's confusing, and not necessarily confusing, but like if you're looking at the map, like I was just looking at it earlier, and Texas is green, and so it's a very colorful map, and some of them have that reciprocity.
Which one of these links is the map?
The
licensure
statutes.
All right,
Yes.
let me pull it up real quick. I'll put it on the screen too for this. Oh yeah, a bunch of states are green.
Yes.
And if a state's green, licensure of title only or certification of RDNs.
Yes. So that means that you can't be in Pennsylvania, say you're a dietitian, without having the credentials to do so. Licensed dietitian nutritionist is the LDN title, is what's used there.
Right. But all these green states don't necessarily mean that you can practice there with your PA license.
Yes. So,
Right.
and something to consider too. So like Pennsylvania, for example, there is licensure here. And technically, if you're reading this map, you would see like, oh, it's only title protection. It doesn't mean I have to be licensed in the state. But that's not necessarily the case, because you may still need to get licensure to get referrals from physicians, or to accept payment, like for being an insurance provider, that they would require you to have the license. So those are things to consider, that even though it's technically like a green state, that something else would be making sure that you can still practice and receive payment being in another state without having licensure.
So most states are red, and that's practice exclusivity.
Yes.
That means you need to have the license in that state for that state?
Yes, you're required to have a license to practice MNT or dietetics, and there are certain exemptions, but that would be the red usually means no unless you have a license there.
And then there are some orange, yellow states that have title protection without formal state regulation. So California, what is this? Or is that Virginia? And I guess that's, what is that? Like Wyoming or one of them?
So.
Square
If you
states?
click on it, it brings it up.
Does
what
it
the
really?
name is.
Well, I feel like I should. It's
Colorado.
Colorado. Wow, I'm an awful American.
I don't know it
Jesus.
either.
So in those states, I guess, does that mean that you can practice there because you have a licensure in PA and they accept states elsewhere?
It depends. Usually, yes, you could with the orange, whatever color that is, yellow. That generally, yes, you could. You just want to check. So that when you're looking at the map, there's links to like the state boards, and that's where you'd want to check to see if there's any kind of exemptions or rules to it. But generally, you could practice in those states. There's also, you want to keep an eye on this and check consistently. Like New Jersey, for example, didn't have licensure. And then they now have licensure, but then it wasn't enacted right away. And so you're still able to practice in New Jersey without having a licensure, because they didn't have the licensure all set up, and everything got delayed with COVID. And even now with Pennsylvania, there's stuff that we've been trying to get through in terms of updating the licensure information. And so you consistently want to make sure not only just checking this map resource, but also going to the statute and reading it, because even like the one for Pennsylvania, for example, if you read through the link, it shows, it specifies that for that specific state, you may need to be licensed to accept payment and that it might not preclude you from, like with insurance, for example, and being a provider, is that you would need to be licensed to accept payment. So be in network with.
Yeah, that's a
insurance.
weird way of wording it, and it kind of wraps around the point a little bit. But there's 2 states finally that have no licensure of practice or title currently. That is Arizona and Michigan. And that would mean that you could just see clients in those states and doesn't matter at all. And anyone in those states could practice without licensure.
Yes.
Which I have a feeling that will change.
Hopefully. And some of the issue there too is that there's no title protection. So no title protection of the word dietitian.
So I'm a dietitian in Arizona.
That's, or some states have protection for like a nutritionist, which is one of the things that Pennsylvania, where people are working on trying to get that looped into. It's not just licensed dietitian nutritionist, but the term nutritionist or licensed nutritionist, kind of lumping that in, that person is also, a dietitian. So those are things also to consider as well, is that, people can call themselves something else in another state and kind of flying under the radar a little bit.
Yeah, it's interesting. I'm looking at the states that are green now, and some of them do note exceptions, licensure by reciprocity, and then they list a specific statute. So you can't go wrong digging into this stuff a little bit, just looking up these statutes and doing some homework if you're looking to practice across state lines.
Yeah.
So
it's one of those, the Academy has like office hours too that I would suggest, reaching out to them for, and then also just reaching out to the board too. Like, I reached out to someone in New Jersey at one point because I saw that there was no update on licensure, but then I was reading somewhere that there was licensure. And so I just emailed someone. They're like, oh, we have licensure, but it hasn't been like finalized through or whatever the, term is for it because of COVID. It was delayed. So you could still practice without, because there was no way to obtain a license. So can I still practice over there? And being in Pennsylvania, I do have clients that are in New Jersey.
And they could just cross the bridge and then do the appointment with you if they wanted to, right?
I had one client, and they're like, I'll just drive over the bridge. I'm like, near the bridge, I'll just drive over and I'll be in Pennsylvania.
Maybe they could swim over.
Maybe.
All right. Yeah, a lot of stuff with states. So should you get a license in other states or each state? Is it worth it?
Yes and no. It could be, I should say. Because one, it can be pretty pricey to be licensed because you're paying for all of these licenses to have.
Don't you have to maintain that too?
Yes, you have to maintain them then too. And so there's that aspect to consider. Generally, I think about if I have a bunch of clients in one area, like New Jersey, now that they're, the licensure seems like it's, something that I can now obtain and is now active, is I would get licensure in New Jersey because I do have clients that are often in New Jersey. And so that would be something to consider, is if you have a lot of clients from a certain area, or if you're someone who's living in a certain area and you're moving and you want to maintain your client base, it might be, again, worthwhile to maintain a license in 2 places. Or some dietitians are very close to a border on a state.
Yeah.
And so they might often have, clients that they're seeing across those state lines too.
Just wondering if anyone, because there's this 4 points area. It's Utah, Colorado, New Mexico, and Arizona. Famously, there's a point in those states where if you're standing in a certain spot or like laying in it, you're in 4 states. So I have to wonder about a dietitian, because that's got to be a nightmare, because each of those states is a different color on this map.
Yes,
at the moment.
It is a different color.
So it's kind of wild to think about a dietitian in this area trying to practice and maintain licensure.
Yes.
It's kind of a nightmare. But, if you're right by a state line, couldn't hurt.
Yeah.
And if you can afford it.
I'll just throw this out there that I'm not 100% well-versed in this map, and there's a lot of, needing to click through things and look through. So that's why I highly suggest going through, go look at the map, click through the links, but then also reach out to the state boards if you need to, because they've been pretty responsive from what I've seen with questions through email from the ones that I've reached out to. But that might be something just to do some digging on.
Definitely a case-by-case thing where you should check your state and the state you want to consider practicing in.
Yeah.
So if someone didn't want to be licensed in a particular state, are there loopholes to get around it with coaching or some other title of service?
Yeah. So this is something that I consider a slippery slope. And
it's a gray area.
It's an area that you always want to go back to, even if it's technically legal. Is it ethical? And is it a violation of the code of ethics as a dietitian? So that's something to consider. Now, I've done classes that are non-medical nutrition information, so generalized nutrition info, that I've had people that you're not checking where they're located because it's not individualized. So those things could be fine. It's the aspect of like providing medical nutrition therapy, wearing your dietitian hat. And so just calling it coaching doesn't mean that you're not practicing medical nutrition therapy and you're not acting as a dietitian and being a dietitian. And so those are areas where you'd be doing something unethical to get around, a loophole. And, is it worth risking your license and the ethics that go along with that?
Yeah, so you should tread carefully if you're looking to do that. Yeah. Should we make and sell dietitian hats? Would they just be an apple? Do you think the apple is really the pinnacle of healthy eating?
No,
as it once was considered an apple a day.
I don't even know I don't remember where that came from.
I have no idea.
I feel like it came from, like, there was a story behind it, but I don't know if that's actually true.
Propaganda. But it's big apple for you.
I guess berries would be
big fruit.
If I was using the fruit.
Well, it would be berries or like cruciferous vegetables.
Yeah.
Right.
Or a banana, because everyone hates on bananas.
In terms of recognition, really? Whatever. Yeah. That's the whole thing. Bananas are popping off a little bit wild right now. The Cavendish is in danger.
Yes.
But, anyway, a bit of a side note. If someone takes insurance as an in-network provider, how do they know what telehealth coverage is, and how do they know what or if insurance will cover?
So
I'm reading.
It's a lot
off my teleprompter there.
And so when we think about it being doing telehealth, especially as a dietitian now, and then also accepting insurance, which we're going to talk about.
So this is asking how to confirm coverage.
Yeah, like how would you know if telehealth is covered? And even now, with COVID still being a thing, with the telehealth, a lot of things have been
got that Amnicram coming along.
A lot of things have been expanded in terms of telehealth coverage,
but companies' policies are changing, as we've discovered.
Yes,
much to our dismay.
So
very confusing.
Things with telehealth are consistently changing. Each insurance has their own way of dealing with telehealth. So there's two things really you want to check. The first is the medical policy. First, just to know in terms of, is telehealth covered, or is, what diagnoses are covered, CPT codes, like things for billing as a whole. Then there's also going to be a telehealth policy.
Do you use more than one CPT code?
Yeah, 97802, which is the initial, and then 97803.
Subsequent?
Yeah, and then there's also, I don't do
one
a lot.
One for group?
There's one for group.
Right. Well, you're using the same one or two over and over.
Yeah, so I'm using the same one, so it's pretty easy just to search for those in a policy. But there's a telehealth policy that insurances would have. And so looking at that.
For those specific CPT codes.
Yeah. So it's their full telehealth policy. So usually I'll do a search because it applies to all providers. Usually there's like behavioral health section, medical section. And then they'll list generally the codes that are accepted or what specialties can bill using telehealth. And so those are the things that you'd want to search for the specific code, making sure you're checking for, are these ones covered for telehealth? And then also making sure to note what the place of service is and the modifier that's needed.
It's such a mess.
It is.
Trying to figure out who wants what from where, because some insurance companies want the modifier and others don't.
Yeah.
Some of them you have to jump through hoops to actually get this clarified for you. And some people you call, they don't know and they don't understand what you're talking about.
Yeah.
So good luck.
That's been frustrating. But if you have the policy, you can refer to something, and then because every insurance, I have insurances currently that are different. Some accept a modifier, some don't need a modifier, and then others that are using different place of service codes and modifiers. So it's just something to keep an eye on.
You got to dig, you got to do your homework, read through the policy carefully, call them if you run into any issues, and then ask questions.
Yeah. And make sure you sign up for updates for the policy, because I sign up for insurance provider updates. So there's usually like a provider newsletter or something like that. So I get an email, and most of the time the policies don't apply to me. It's like for new drugs that are covered, or, this procedure. And so I'll just scan through and see if there's any updates. But it keeps you in the loop to see what's upcoming, and then also to make sure that you're, again, staying up to date with what they are accepting for codes for payments, so you're not running into denied claims.
Yeah, it's a shame how niche medical nutrition therapy is and how it's not exactly a common service at the moment. Hopefully that changes in a few years and things pick up steam, and then insurance companies will further clarify or make it more explicit, because right now it's like a needle in a haystack sometimes trying to figure out if you're good.
And that's what's frustrating too. Like I was just reading, I ran into the same thing where an insurance said you have to use a specific platform for telehealth. And the platform they said that I had to use is ones that only doctors can use, and explicitly says on their website, this is only for physicians.
Yeah, physician use only.
Wait, so
you're not a physician. So what do you do?
Exactly. And so those are situations where it again, because dietetics is such a niche area that it's hard to sometimes get the correct person to speak with who understands that we are not physicians. And so we're not going by the same things necessarily.
Or maybe you just need to suck it up and go back to medical school, get your PhD, your MD or whatever.
Why not?
You should do your DO is what you should do. Holistic, supposedly. On insurance, conveniently segueing into the insurance-related section of this FAQ. So, is it worthwhile to become an insurance provider? This is wildly debated.
Yes.
Very, very fiery debates taking place on Facebook and Instagram. From what little I've seen of it, it's interesting, the nature of this conversation. What's your take?
So absolutely. I am an insurance provider. It's something that I recommend for a few reasons. One, it's like 90% of my clients. It's a great way to get referrals because, when you're going out there, maybe it's not necessarily you're going out physically now, but maybe reaching out electronically. But when I was going out to doctors' offices and in the area or businesses trying to get clients, I use that as a way to say like, hey, I accept insurance, so you can see me at no cost to you. And so, or there, you get appointments for a discount, whatever it might be. So it can certainly increase, client referrals. I also have quite a few clients recently who have just found me because they did the search for a provider on their insurance company's website, and then they found me on there. So it's definitely a great way to build your client base, get clients. And some people might not have been, interested in seeing a dietitian or that many times without being able to have the coverage for it as for someone. So it might not be as feasible in terms of like cost to pay for dietitian services. Whereas if the insurance is paying for it and they're not paying an out-of-pocket cost, then it can certainly be a way to increase, the likelihood that a client would utilize services of a dietitian.
Well, if it's free to them because they already have an insurance provider, or a plan, then of course, it's free to them.
Yeah,
they're already paying. Basically, it's not free; they're already paying for it.
Yes,
and they just don't know it.
Exactly.
So that's there's an obvious come up. I mean, it's you become a provider, and all of a sudden your name is in all these very searchable databases and places where you're discoverable.
Yeah.
And
I've had clients who call their insurance company and they, speak with like an advocate or, someone associated with the company who says, we can print off a list of dietitians in your area or something like that. And then I'm on the list and they call through the dietitians and, I'm the one that gets back to them. I'm the one that calls them back or something like that. And so again, you're visible. And again, you can use that as a selling point to, connect with businesses and things like that.
There's obviously things to deal with when you become a provider. You have to kind of learn the game of working with insurance companies and you got to play by the rules and whatnot, but it is sort of an easy entryway to gaining clients and getting your feet wet.
Yeah.
From what absolutely. I can tell. So how do you know which insurance companies to become providers for and to be in their network, become in network with?
So I did just a Google search of popular insurance companies in Pennsylvania when I first started, because I wasn't sure outside of like the two that I was aware of. And so just searching through what would be insurances in your area. So you might be aware of a few of them already, but like for example, I work with Highmark, Blue Cross Blue Shield, Independence Blue Cross, and Blue Cross Blue Shield is like the parent company, which I never really understood that until recently. It's like the parent company and the Highmark's under it. Independence is under it. And then there's like what plans underneath all of those. But United Healthcare, Cigna, and Independence Blue Cross.
So that's interesting because you're with Blue Cross Blue Shield, but that doesn't necessarily make you a provider automatically to both Highmark and IBX?
Yes, you have to apply separately to be an insurance provider for Highmark and for Independence Blue Cross. And I didn't realize that. And so this is something else to consider too, because there's a payer sheet with independents that I found that's like I don't know, like a 6 or 8 page payer sheet, and it explains like if this prefix for somebody's insurance card that you bill this plan, because I've often called insurance companies because I come up with a random plan that I don't know like where I'm supposed to bill it to. They're like, bill to your local. I'm like, who's my local? I don't know who that is. And so those kinds of things, like how do you know that information? And so I found this like payer sheet. So if you don't currently have it and you need an independence payer sheet, Google independence payer ID sheet and it should show up. If not, email me and I will send it to you. But it's a great way to just know where you're supposed to be billing things when people say local and you don't know what that means and they can't really tell you. But those are commercial insurances. And then there's also like public insurance, Medicare, federal, and then Medicaid, which is state run and not for Medicaid. It's very specific to the state as to if they accept dietitians into that network and coverage. And then obviously the private insurance piece of it. So
a lot to consider there. Medicare, Medicaid are public government options. You have to apply to each of them separately, I guess.
Yeah, I couldn't get in with Medicaid, but because they didn't have dietitians in Pennsylvania that they credential with, but Medicare, yes. And I don't necessarily get a ton of Medicare clients, surprisingly, because part of it is the limitation on coverage. So that's something you'll run into with insurances. Although it's great and it can be a great way to get referrals, something to consider is what do they actually cover? How many visits? Are there specific codes that they'll only cover or diagnoses? And so Medicare is pretty limited in that. So that could be,
I'm not sure if you said this explicitly, but if you get in network with multiple insurance companies, prepare for them to be very different from one another. There's no real standardization with a lot of the stuff that they require in terms of what's covered and what codes, and you'll have to treat them all as individual entities.
Yeah. And just keeping, you'll become well-versed in it once you're kind of in it. And I'm more well-versed in the plans that I see typically than I am with some others that I have to kind of do a little digging on once I get a new client. But just jot that stuff down in terms of, what are the most popular things or where to kind of locate the information. It just makes it a lot easier as you're kind of getting your feet wet with insurance and billing and whatnot.
So how does one become an insurance provider? What does the process look like?
So there's a couple of things you'll need before you even start applying to be a provider. So your EIN, your tax identification number, whether that's an LLC or a sole proprietor, whatever it might be. Your NPI, you will need that as well. And so if you're an individual, you'll get an individual NPI. You'll need professional liability insurance. And then if your state has licensure, you will need also state licensure. And you have to upload all of that information. So the next step would be what's called the CAQH online application. So it's a credentialing database. And so it's pretty lengthy and you have to update it every 90 days and attest to your application, making sure everything is correct. But that is, you'll use that, like there's an ID that you have that you would put on the applications that you submit to each insurance company. And so it's a way to kind of reduce paperwork and all of that. And so it's, I guess, fairly-ish new when I was starting to be in network or apply to be in network. But it's a credentialing database. So once you have the CAQH approved and set up, you can then start the application process for each individual insurance company. So you need to apply to each insurance company that you want to be in network with. So there's a couple ways to do this. I just Googled how to join, how to be a provider, how to be in network with whatever insurance company it might be. And most of them have on their website a provider section and then a section that says join our network. And most of the applications are not super lengthy because that's in part you're filling out the CAQH for you to have all of your credentialing information on there. And so you're just entering in, like your name, your NPI, the business name, if you have one, your CAQH ID, and then your specialty. And so that would be kind of first step. And then the next step would be what's called credentialing, where they verify your information. And then the contracting, which is the actual process of being in network where you're signing off on the contract. So
there's quite a bit there to do. And you've obviously been through this a few times. It's another one of those things where I guess once you do it one time, it gets a little easier.
Yeah.
Afterwards. And we do have individual videos for some of these steps. So if you're listening on through the podcast and you're not watching on YouTube, would encourage you, if you're curious, to check out the YouTube channel. Link to that will be in the show notes as well. We have got short form video content on certain steps like getting your MPI and more upcoming. So please feel free to check that out if you're curious. But following that, can you have a niche as a dietitian accepting insurance?
So honestly, when I was applying to become a provider in network, and even on a recent application that I just did, they only want to know if you're a dietitian, what your specialty is. So it's like, are you a doctor or a dietitian, whatever.
So your specialty is dietetics.
Yes.
Right.
Yeah. So they don't ask you, if you specialize in prenatal care necessarily, or plant-based nutrition, or whatever it might be. And the provider directory doesn't necessarily list that, at least for dietitians, because it's not like a doctor where you could search for like a gastroenterologist or primary care physician. You're searching for a dietitian. So.
Well, you don't have to credential yourself as an expert in, say, type 2 diabetes or kidney care or anything like that, whereas a doctor would.
Yes.
You've got a nephrologist who would be a kidney doctor, and that would have to be noted. They have extra education for that. You as a dietitian, you don't.
Yeah.
So anyone can say they're a specialist in whatever. As a dietitian, there's no credential proving that.
No, and there's like, the whole ethics behind, what's considered proficient and expert and all of that kind of stuff. But even any of those like certifications, it's not like you can't work with someone if you haven't done a training in X, Y, or Z. It's making sure that you're staying within your own individual scope of practice as a dietitian, because there's obviously a lot of areas in which you can go in dietetics. But in terms of like insurance, they kind of don't ask you for that information necessarily. And it's not listed in the directory. If you're searching for a dietitian's, if you search for someone, you'll see specialty listed as dietitian. So
I have to wonder if in coming years they'll allow for dietitians to specialize their credential in any, or do you see that happening where there's a branching path for dietetics to where they specialize in a certain disease or disease type or certain conditions?
Yeah, and there's certainly like the CDR and the Academy have specialty credentials. So there's like there's ones for kidney disease. I forget all the exact names. There's ones for like tube feeding, which is not an area I work in.
Well, like clinical?
Yes. So there's like very specific ones, and then even like the conditioning and sports dietetics. I can't think of that one off the top of my head either. But there are specialty certifications. But in terms of like insurance, they're not asking for any of that necessarily.
Yeah, I don't think that stuff it's not really like a one-to-one thing where they're even looking for that. But maybe that'll change in the future. That's one thing that this podcast might age out of. Again, these are current situations and standards.
Yeah. And some people have used, I haven't run into this often. I ran into it with one insurance company, but closed networks where you apply to become a provider in network and you're denied for the reason that they say that there's too many dietitians or it's too saturated and that their network is closed, especially if it's like a certain area. So some people have appealed that decision to the insurance by noting that they have a specific specialty, to say that they focus on childhood nutrition or pregnancy nutrition, and and so they can use that as kind of like a way to, here's why I need to be in network.
Here's why you need me.
Yes. So,
but it's a tough case to make right now. At least I can see this changing quite a bit in the future. A lot of other fields of medicine have developed further and further to where at one point, their podiatrists at one point didn't exist and then suddenly they did. I'm sure it's just going to continue to develop, and hopefully dietetics will branch the way medicine has.
Yeah.
We'll see.
And even something that's new is like telehealth, like on the directory. Before it wouldn't say if you were, utilizing telehealth, and now it like shows underneath my name on certain directories that like I am participating in telehealth. And so there's like a little green check mark and like it says telehealth. So that's new. And I think again, like the nature of everything, that hopefully that'll be the case with like specialties or other ways to kind of build in more information to that directory. So when people are actually looking for someone, they have more information to go on. Now with that said, I'm talking specifically about insurance companies and their directories, because there are other directories out there, and like the Academy has like a find an expert.
Directories. Are we, those directories?
Yeah, like online.
Businesses that solicit you to be on their directory?
Well, there's those for sure. And then like
They're actual credible directories.
Yes.
Okay.
Like the Academy of Nutrition has a find an expert section where anyone in the public can use it to find someone. And so you can set up your profile on that. And that indicates like you can add in their specialties and check the boxes off for those. So what we're talking about was more with insurance databases, but there's other obviously locations where you can list your specialties to, gain clients in that way.
Well, if you have a website too, you can list whatever you want on that.
That's true.
You can do whatever you want on your own space. So do insurance companies have a set rate that they pay you, and are you able to negotiate that rate?
So you get a set fee schedule when you become a provider.
What's a fee schedule?
So this lists how much you would be paid per unit of billing. So a unit of time is usually like 15 minutes is 1 unit. There's, the 8-minute rule and whatnot. But in general, a unit is 15 minutes. So if you see someone for an hour, it would be 4 units. So you get this fee schedule that's specific per unit. And you can request this when you're in network as well, if you're not sure what it is. I had a hard time getting my exact rates prior to being in network with the insurance company. So I will say it's not the norm for them to give you those rates while you're in this contracting phase, that afterwards you can get them. And something to also consider is that you can't share your rates with other people because that is considered a contract violation.
That's a no-no.
Yes.
Don't kiss and tell.
As to what they pay you, you can obviously very much tell people what you are, what your rates are, as in like what you are charging. But you can't share what you're being reimbursed by insurance. So you will want to determine what your usual customary rate is. So what you're going to bill every insurance company, that should be the same flat fee, however it might be. But you can negotiate rates. I haven't had success with this, but other dietitians have had success in terms of exhibiting a case as to how many clients they have and a percentage that they're looking for in terms of increase. And so it just might be something they can say no, and you're just kind of left with whatever your rates are. But I have found the rates to be pretty reasonable as they are.
Yeah, just to clarify, you're billing the insurance company, not the client.
Yes.
And the insurance company is reimbursing you for your services. So how did you initially figure out billing?
Lots of online searching. The Academy has a really good billing section now. So when I first started billing, it was in 2017. And so most of the resources I used were actually what the insurance company had on their website. So they have provider manuals. They're very lengthy and they're not specific to dietetics necessarily. So you kind of have to sift through, but there's specific information about billing in there. So that's a really great place to start, is with the manuals for the insurance company. Take a look through there. Now there's a lot of really good resources out there that I use in terms of like keeping myself up to date. And also if there's things that I run into. So the Academy of Nutrition, like I mentioned, they have a lot of great resources on telehealth, billing, payment, all of that. We'll link that down below as well. There's groups on Facebook that are really useful, like insurance credentialing on Facebook. The Nutrition Entrepreneurs, if you are a member of the Academy and you join the Nutrition Entrepreneurs, they also have a lot of great resources, and then they have a mentorship program too. So, but a lot of kind of trial and error and figuring things out. Initially calling the insurance companies myself, trying to just kind of understand the jargon of everything, because I didn't know what a POS meant. It's a place of service.
Place of service, point of sale. There's a lot of acronyms and things that are used in various formats. So you got to be careful with that stuff too, I guess.
Yeah. And if you don't know what you're looking at, like when I first looked at a CMS 1500 form, I had just like a blank one. Like, are all these boxes supposed to be filled out? How am I supposed to fill all this out? And there's a lot of systems out there that make it a lot easier now. So you don't have to fill in all of the information that's on a form, because it doesn't all apply to you as a dietitian. But definitely utilizing the resources, again, from the Academy can be useful if you're a member. There's, again, those groups on Facebook that have lots of great information there that dietitians are sharing. And that's a
Well,
good place
if you're
to-
seeing this after September 2022, I will have completed an externship in billing and coding. So feel free to reach out to us and maybe we can help you out too. But
Yes.
all right, what happens if insurance doesn't pay for a claim? What can you do? Is there an appeals process? Can you bill a client? What's the general best course of action?
So first is you want to check your reason for denial. So if there's an error on your part, you can submit for a corrected claim. If there's lack of coverage, so maybe you thought something was covered, but it wasn't, then it could be patient responsibility. So when you get back the EOB or explanation of benefits, this would specify if the patient has a responsibility. So it's a non-covered service, or if maybe it went to their deductible, so they have to pay out of pocket first. It is best practice that with billing insurance and just having a practice in general is to make sure that you have policies in place for payment. So when will you be billing insurance? Will you submit appeals? What's the time frame in terms of if it's denied? How much is it costing the patient? So their patient client, so they're aware ahead of time and not all of a sudden stuck with, $200 bill from you. But definitely checking the denial first, calling the insurance company if you need to, otherwise submitting a corrected claim if it's something that you notice that you did incorrectly. And then the other thing to consider is that if you're billing an insurance company for a service that is covered and you are in network, you will get what is called your, you bill, and then there might be a difference in terms of what you're billing and what is your contracted rate. So your fee schedule is determining how much you're getting paid per unit. So if there's a difference there, like your rate is higher than what the insurance company is paying you back and reimbursing you, you can't balance bill and bill that portion. That's the difference, because that can violate your contract. And in certain states, it's illegal to do. So you being in network are accepting those rates. So that's when you're signing off on the contract, you are accepting what your fee schedule is and your contractual allowance. So if it doesn't say a patient responsibility, you can't be billing them for that difference. So
I kind of like the word patient better than client. I'm going to be honest with you.
I
Medical nutrition therapy.
I kind of use it interchangeably. Like I tend to talk about clients when I'm talking about like outpatient or if I'm talking about something, but sometimes I use the word patient when I'm like referring to insurance and billing because it just seems more clinical. I don't know.
It's a form of medical expertise and you're administering care. I mean, psychologists call their people they see patients sometimes.
That's true.
I mean, I don't know.
Yeah.
I just think the word patient's more official. It's medical nutrition therapy after all.
That is.
So, and anyway, how do you actually get paid by insurance companies? What do they do? They send you a check?
So they'll either send you a check, or if you enrolled in EFT or electronic funds transfer, then you'll get direct deposit to your account. So which is also, you're gonna need a business account. We have a video on setting up your practice. So these are all things that are in that as well. But if you're doing a check that's getting mailed to you, it'll take a little longer. So that's and also it's paper and stuff, so it's a little less secure. So it's definitely a benefit to enrolling in the electronic funds, because then you're getting paid maybe a little bit sooner than waiting for the check.
Well,
So,
you just link a bank account, right? And they just send it in.
yeah, usually it's every, they get batched together, the claims. So like normally every 3 weeks or so, I'll see a payout for like a 3-week time frame, I should say, from when I see a client to when I get paid for it. But sometimes I'll have seen a client like a week ago, but just gets batched together with another set of claims. So, but usually it's about 3 weeks turnaround time that I find.
Something interesting to note, I think, is that linkage of a bank account is a two-way street. And that sometimes if they decide, I don't know if we want to talk about that.
Oh, so they didn't pull it from my bank account. So we won't necessarily go into detail here, but
We've had some issues with a certain insurance company changing their policies.
Yes.
And then retroactively deciding that service wasn't covered when their policy did cover it then.
and this is months later. This was something from like March or May.
Yeah,
And
no
all of a
names
sudden-
named, but
But one thing I will say with that is that they didn't pull it from my account necessarily, but they deducted it from what they were going to pay me in future claims. So there was a nice little line deduction that I noticed. It's like, wait
that's
a second.
how they get you right there. Yeah.
something, making sure you're looking at those EOPs, keeping a track of, I have a tracker of when I submitted a claim and to where, to just keep everything, so you're on track on top of what things you submitted. And if it's been a while, because if it's been like 4 or 5 weeks, probably something is wrong. It got denied, for me anyway, in terms of like, I'm consistently getting paid in a certain time frame for claims. So if it's been 4 or 5 weeks, there's an issue with the claim, so I need to go back and check. But then also noting that, hey, these aren't adding up as much. So that was a red flag to me.
Yeah, it's a good idea to be vigilant with that stuff and really check things over.
Yeah.
Like really check. So, and speaking of checking things and being vigilant, sometimes you need to hire out, depending on what you're doing. You've worked with, you have an accountant. You've worked with an attorney. Mm-hmm. There are other professionals that can help you. How do you know when to hire out, and or just like when should you?
So there's a lot of stages in your business that might require, and certainly I recommend speaking to someone who is specialized in that area. So the one is an accountant. Certainly can be helpful with setting up the business, but also filing taxes. If you're hiring someone and you need to do like payroll, they can help you with those kinds of questions. An attorney for like any kind of contracts or determining what your business is going to be in terms of LLC, like what makes the most sense, corporation. I'd say both of those are kind of like my go-to in terms of, I just recently reached out to my accountant about, we LLC'd My Dietitian Journey. So making sure that, what information that she might need for filing taxes and, what stuff to have on file and, what I need to set up. And then speaking with an attorney for like contracts and things like that. So I think one thing to consider is that it's, you don't have to do everything and you shouldn't do everything, because you want to make sure that you're reaching out to those people who have the expertise and can best guide you along this, I almost said along this journey, like it was planned of my
How dare you? Obscene.
My dietitian journey.
That's the whole point.
But someone who can help you with these kinds of things. So you're doing things correctly, but also you're not worrying about what things, I'm talking about.
It's a normal thing to contract out for services within a service or within a company. It's standard practice in other areas of business. You're a dentist. Probably does it. The person who's building a room onto your house is probably doing it. That general contractor is going to hire a plumber or an HVAC person. This is standard across all forms of business to hire out specialists to take care of certain things. You as a sole proprietor or like one person LLC, don't feel like you can't do that or you shouldn't do that or you're inadequate because you can't properly do things easily enough to where you're not like pulling your hair out and wasting hours of your time. It's a cost benefit analysis. Mm-hmm. It's probably going to be worth to hire someone at a certain point when your business grows.
Yeah.
Don't feel like you have to do everything by yourself.
No. And even like, with hiring people too, when you're setting up your business, you might utilize like services, and there might be things that you continue to do on your own and not hire for. Like I do all my own billing right now. And so those are things I didn't want to hire somebody for because I was able to figure it out and file claims efficiently. And, Adam's going back to school for that and to get that credential. But that's something that people do hire for. They hire someone to, schedule their appointments. They hire someone to file their claims. They hire someone for that. And that's doesn't mean that they're any less of a dietitian or a private practice owner because they hired someone. It's, again, the cost benefit of is what's worth, where do you want to be spending your time and energy? And if it's not worth it for you to do this aspect and it's better for you to hire someone and pay them, then that's the route to go.
Question for you, Toe. So if someone, say, is in their undergrad and their plan is to get into private practice, do you think a finance minor or accounting minor would be worth it to maybe handle this stuff and then also maybe hire themselves out as a specialist in accounting for dietetic, like private practice? Do you think there's room for that? I
think there definitely is. I think there's definitely space for areas like, someone who's going to be billing or doing accounting with having an understanding of dietetics and is integrated enough in the field to understand what that looks like. And because one of the things I keep finding, especially with attorneys, is the one I'm working with now is really nice and very small business oriented. But a lot of the attorneys that I was reaching out to before and doing free events with had no understanding of what a dietitian was. And We're kind of looking at it from a medical standpoint, which is a different understanding of, medical field. Having that knowledge is certainly useful, and understanding HIPAA, but also like contract language and how that relates to dietetics. It was just, I was trying to like explain to get someone there. And so I think having that knowledge, I think even just having the understanding of accounting, like I had a little bit of a base understanding and, with my parent, my dad in particular, but if you don't have that baseline, it could be pretty intimidating to know like what you need to do, how you need to do it, how to keep yourself organized with it, and then like what matters versus what doesn't. So that's,
and
certainly.
even if it's possible for you to become an expert in that slice of accounting that relates to dietetics, is it worth the time and investing to learn that, or should you just hire out and not have to worry about it ever again? Yeah. Is it worth the cost? It's a question. And
I think even with any of those I think having some kind of base understanding is useful, but it doesn't mean, you need to be the one to do, like, I have an understanding of taxes and, those kinds of things. I don't want to file my own taxes though. I did it a few times as a business owner. It was a terrible idea.
I know how to change my own oil. I'm still going to go to Jiffy Lube.
Yes.
I would rather pay someone else to do it.
Yes.
Is it worth the money? Is it worth the time? It's up to you to decide, but ultimately it's your decision. Don't rule it out though.
Yeah.
Consider it. All right. Is that going to wrap it up for here at the My Dietitian Journey podcast? I think so. I'll, if you're on the podcast and you're curious about jumping to a specific question, by all means, check out the YouTube channel. I will have them posted out by timestamps. All relevant links will be in the description and the show notes. Either way, any final thoughts?
I think just overall, something to consider with dietetics, because there's so many areas to go, things to consider, especially with starting in practice. And we've talked about this quite a few times in terms of like, should you hire someone? Should you not? And one thing there's a lot of mixed thoughts here as to, do you need a coach? Should you be hiring someone? And the same thing we were just talking about with like hiring an attorney or, getting an accountant and things like that is you can certainly go at certain things your own and carving your own path and figuring it out. But if you need to enlist help, whether it's paid services, free services, online resources, whatever it is, it doesn't make you any less of a business owner or a dietitian or anything like that. That is a completely normal thing to do and encouraged to reach out for assistance. So just wanted to say that.
Words of wisdom from the great, the immaculate, encouraging, outstanding Felicia Peraza. All right, with that, we'll get out of here. Thanks so much for being with us. Tune in next time where we will do more podcasting and videos. Feel free to check us out on YouTube, Facebook, and Instagram. Links in the description. Thanks so much.